morning, you're watching the 8 o'clock news. I'm Rishika Barua. Well, it is a Diwali release for Covaxin. That's our top focus story. Here's a look at the headlines. WHO has granted emergency use listing to Covaxin, making it the first Indian-made COVID-19 vaccine to get a WHO approval. But the World Health Organization has said Covaxin data on vaccination of pregnant women is insufficient to assess safety or efficacy just yet. Prime Minister Modi held a review meet with districts having low vaccination coverage today, said can't be lax just because we've hit the 1 billion mark. COVID norms go up in smoke ahead of Diwali. Huge crowds are seen at marketplaces, not just in Delhi but across India. The country is with you, Rahul Gandhi wrote to Shah Rukh Khan after Aryan Khan's arrest. Rahul Gandhi wrote a letter to Shah Rukh Khan on the 14th of October, 6 days after Aryan Khan was jailed. And a lifeline for many during the lockdown, NDTV demand surges. The scheme has run out of cash. 23 states have run out of cash for the wage guarantee scheme. Meanwhile, Ayodhya is lit up in over 12 lakh lamps. Also, massive fireworks on display. NDTV reports from Ground Zero. Our top focus story tonight. After 7 months of deliberations, the World Health Organization has granted emergency use authorization for Covaxin, the first Indian vaccine to be approved by the WHO. The Technically Advisory Group, which cleared Covaxin, comprises of regulatory experts from around the world. So it is a Diwali release for Covaxin. Vishnu joins us with the very latest. Vishnu, great news for Indians vaccinated with Covaxin. Over 10% of our population has been given Covaxin.
Well, I think it is an absolutely fantastic day as far as Covaxin is concerned, because it is, as you mentioned, the first Indian-made COVID-19 vaccine which has been approved by the World Health Organization, the premier international health regulator in this particular context. This means that Covaxin is deemed to be safe enough to export to several other countries, to also provide the various United Nations and the World Health Organization facilities through which vaccines are transported to countries which need them the most. Several African countries are well short of having an optimum number of citizens who are vaccinated. So that's number one. However, as you mentioned, it is important to note that the World Health Organization says that there are some data still missing, insufficient data as far as the safety and efficacy for pregnant women is concerned. So more data will need to perhaps be submitted to them. Also, there is no statement on the use of Covaxin for children. That's something being looked at very closely here in India. But all in all, after a very long process, after a very long time, this has been cleared. And I'll give you one more example of where it's going to help a lot of Indians. Those who were traveling abroad after having received 2 doses of Covaxin, for example, Indian students studying in the United Kingdom, in Canada, in the US or in Australia, were not deemed to have been vaccinated at all. And therefore, there was cases, any number of cases, where students would actually end up getting another vaccine. And the science behind that is very dodgy. So they'd go to this particular country for their studies, they would quarantine as required, and eventually get another vaccine. So mixing and matching vaccines, which is not recommended at all. But now that the WHO has said that Covaxin is kosher, it's good to go, it is safe to go as far as people above the age of 18 are concerned, then it means that it will be accepted by regulators around the world. It will facilitate the entry of Indian citizens in a much easier manner.
Well, absolutely. Indian citizens can now travel to countries where WHO-approved vaccines are indeed allowed. Thanks very much, Vishnu, for joining us with the very latest. It's good news for Indians this Diwali. Let's shift our focus now. Prime Minister Modi held a review meeting with districts that have a low vaccine coverage. This was a meeting that was held today via video conference. The Prime Minister has asked states to focus on the second dose. The Prime Minister told officials that there is a vaccine complacency, a culture of vaccine complacency that's kicking in because India's cases continue to remain low. He therefore emphasized on the importance of door-to-door vaccination and said that equal importance has to be given to both doses. He said this because whenever cases and infections decrease, there is a decrease in the urgency as well. Now, the meeting was particularly focused on districts that have less than 50% of coverage of the first dose and a low coverage of the second dose. The Prime Minister interacted with district magistrates of over 40 districts, and there were also several chief ministers present at this meeting. Listen in to what he said.
1 बिलियन के बाद अगर हम थोड़े से भी ढीले पड़ गए तो नई संकट आ सकता है, और इसलिए हमारे यहाँ तो कहा जाता है कि बीमारी और दुश्मन को कभी कम नहीं आंकना चाहिए, उसको आखिरी अंत तक लड़ाई लड़नी पड़ती है। और इसलिए मैं चाहूंगा कि हमें थोड़ा सा भी ढीलापन लाने नहीं देना है, और जहां कहीं भी जो भी कमियां हैं उसे जल्द से जल्द दूर करके ही रहना है। एक एक गांव, एक एक कस्बे, इसके लिए अगर अलग अलग रणनीति बनानी हो तो वो भी बनाइए।
Well, speaking of COVID, India has reported 11,903 fresh cases in the last 24 hours, which is around 14% higher than the caseload yesterday. The country has also witnessed 311 COVID deaths, which is 29.8% lower than yesterday. India has vaccinated 28% lower vaccinations as well. Only 29.27 lakh vaccine doses were given. However, India continues to test over 10 lakh people on a daily basis. Now, positivity rate is down to 1.11%. Now, the good news here is that the daily rise in COVID infections has been below 20,000 for 26 days, and less than 50,000 daily new cases have been reported for 129 days. Our active caseload is also the lowest it's been in 8 months. But while these huge crowds are a huge cause of concern, COVID-19 protocols go up in smoke as crowds are seen across marketplaces, not just in Delhi and Mumbai, but across India really. These are pictures from some of Delhi's markets, just testament to the kind of crowds that are being seen all over. And well, it's not a happy Diwali for all this year, is it? Battling the aftermath of India's deadly second wave, there are many homes, many families who are not celebrating the festival. We take a moment to honour and remember the lives lost.
वो सबके लिए बहुत कुछ करते थे.
Ajit Jain, nodal officer at Delhi's Rajiv Gandhi Hospital, emotional as he shows us his wife Prerna's picture. He saved over 5,000 lives during the pandemic, but couldn't save his wife. A doctor at the Mohalla clinic in Delhi, Prerna died treating patients.
बिल्कुल खत्म हो गया जैसे. जब तक वो थी तो 6 महीने की कुछ नहीं लगता था. 6 महीने क्या, मैं 6 साल भी ऐसे काम कर सकता था.
48-year-old Sashi can't hold back her tears. Her husband was a sanitation worker in East Delhi's municipality. Manoj died in the second wave of the pandemic. She is yet to receive the help promised by the Kejriwal government.
सब कुछ मैं कैसे मैनेज करूं? हो ही नहीं पाता.
दिवाली सुनी लग रही है.
बहुत सुनी.
While some don't have the means to light up their lives, many are yet again ignoring COVID protocols. Let us not forget the sacrifices that people like Dr. Ajit and Sashi and their families have made. Please wear your masks. With Saurabh Shukla in Delhi, Bureau Report, NDTV.
Amid the lockdown, NREGA has proven to be a lifeline for India's poor. Since there's been an exponential rise in numbers, states are now running out of funds to be able to pay for the cash guarantee scheme. 23 states have red flagged a shortage of funds as workers on the ground say that they aren't getting their wages.
At the outskirts of Thiruvananthapuram, Geeta is among a group of 29 families below the poverty line, cleaning a canal under NREGA. She's received only 3 days' wages, despite working almost 10 times as many days.
ഇനി 3 ദിവസത്തെ പണി കിട്ടിയിട്ടുള്ളൂ. 29 ദിവസത്തെ പണി ചെയ്ത് അതിൽ 3 ദിവസത്തെ കിട്ടി. ഇനി ബാക്കി പൈസ കിട്ടാനുണ്ട്. നമുക്ക് ബുദ്ധിമുട്ട് തന്നെ. കൂലിപ്പണിക്കാരല്ലേ, മഴയൊക്കെ ആയതുകൊണ്ട് ജോലികളൊന്നുമില്ല. ഒറ്റയ്ക്കാണ് താമസിക്കുന്നത്. പിന്നെ ഇതിൽ കിട്ടുന്ന വരുമാനം കൊണ്ടാണ് കഴിയുന്നത്. അപ്പോൾ എന്താ വെച്ചാൽ ഇതിനു മുമ്പേ വീട്ടു ജോലിക്കൊക്കെ പോയി ഇവിടെ ജോലി വരുമ്പോൾ ജോലിക്ക് വരും. ഈ ജോലിയുടെ വരുമാനം കൊണ്ടാണ് കഴിയുന്നത്.
Geeta isn't alone in not getting paid, with 23 states running out of funds for the scheme at a time when lockdown-induced economic distress is seeing a massive surge in NREGA numbers. We're barely halfway through the current financial year and NREGA funds have already run out. About 73,500 crore rupees have been made available so far for the scheme, and the government's books show that we are already in the red, with a shortfall of about 8,600 crore rupees. In fact, Kerala, where Geeta works, is one of the worst affected states, with a shortfall of over rupees 500 crore.
1,800 crores is the amount raised by Government of India, and we have already spent 2,196 crores. So all the funds are exhausted.
Across India, these women are literally an army of workforce on the ground. They work hard to be able to earn livelihood for their family, many of them single-handedly running their homes. For days they have not got funds and they are worried what lies in future for them. There is no Diwali for them this time.
Chief ministers like M.K. Stalin to Naveen Patnaik have written to the centre asking for more funds. The Congress has also tweeted, saying that the Modi government has managed to destroy the one saving grace for India, the MGNREGA.
The Mahatma Gandhi National Rural Employment Guarantee Act is on the verge of collapsing under the visionary leadership of Prime Minister Modi, with only 10% of its funds left. But does the PM care about this?
The centre has responded saying that there is no cash crunch. Fund release is a continuous process, they say, and that there has been an 18% increase in fund allocation this year. They also said that rupees 8,900 crore will be available for NREGA wages. But the fact is that the centre cut the funds for the NREGA scheme during the pandemic. Last year's revised estimates allotted about 1.1 lakh crore for the scheme. This year's budget estimates is about 73,000 crore, which is about 35% less. With Sneha Meri Koshi in Kerala, this is Mariam Alavi for NDTV.
And Rahul Gandhi wrote to Shah Rukh Khan when Aryan Khan was in jail. On the 14th of November, 6 days after Aryan Khan was in jail, Rahul Gandhi wrote to Shah Rukh Khan saying the country is with you. Now, after the death of actor Puneet Rajkumar, his eyes have given a new life to 4 patients as his eyes were donated after he died, and the number of eye donations and pledges at the eye bank named after his father have also seen a huge spike.
As thousands of people gathered in Bengaluru to say an emotional goodbye to the much-loved actor Puneet Rajkumar, doctors in an eye hospital in the city were transplanting his corneas into 4 patients.
I get a call from Raghavendra Rajkumar, and it was Raghavendra Rajkumar who called me when Rajkumar passed away also. And he said, doctor, this has happened, kindly come and collect the eyes.
Doctors took up the difficult challenge of splitting the 2 corneas to benefit more people.
We plan to split this cornea into half and give the front portion to 2 people who have front cornea defect and the back portion to 2 people who had back cornea defects. We have never done it before for the 2 eyes of 1 person and all the 4 people on the same day.
The example set by the family, most recently by Puneet, saw well over 1,000 people coming to this eye bank to pledge their eyes.
Beloved Puneet Rajkumar also donated his eyes. Then within 4 days we collected 28 eyes. In one night we collected 10 eyes. 24/7 they are calling me. From all over Karnataka, in a remote place also they are calling from yesterday.
The much-loved actor Puneet Rajkumar
had a reputation of helping people during his life. And even after death, the donation of his eyes has helped 4 different people to see. The importance given to eye donation by his entire family is increasing awareness about this vital act and has seen a spike in eye donation and pledges over the last few days since Puneeth's untimely death. With Govind Murthy, Maya Sharma in Bengaluru for NDTV.
And finally tonight we bring you pictures from Ayodhya's glittering Diwali. Diyas laser shows a record 9 lakh diyas that have been lit just along the Saryu river, and it is in fact a massive fire show that's been organized, but those diyas are in fact a record number, a record in the Guinness Book of World Records for the most number of oil lamps. Alok Pandey sent us this report.
Ayodhya is lit up for the 5th straight year as the UP government showcases the town where the Ram temple is being built. The government is lighting or has already lit 9 lakh diyas by the ghats of the Saryu river in Ayodhya, and also a further 3 lakh diyas in Ayodhya town. They say this will be a new record. These people who you see streaming in are streaming in to watch a light and sound show that is being projected onto the walls of these temples by the ghats of Ayodhya. So that is what is happening right now here in the temple town. But I think the story would be incomplete if we do not speak about 2 other aspects. Number one, perhaps these diyas are also in remembrance of all those who died during the devastating 2nd COVID wave and also the 1st wave of the COVID pandemic. These diyas will also be lit with the hope that in future no one has to die because somebody could not arrange oxygen for them. Nobody has to spend hours outside hospitals or oxygen units. The other issue that we also should talk about is how price rise has choked all of us, and how this festive cheer should also ensure that things can be brought under some kind of control by the government and by all of us. And that's something that all of these people who are watching, you can see this side, so many people here watching, filming on their mobile phones, they will all hope that all of this can come together and this Diwali festivity and cheer can bring real difference to the lives of people. With Kamal Khan, Pramod Srivastava and camera person Vineet Kumar, this is Alok Pandey, NDTV.
And well, from the entire team, we wish you a very happy and a safe and a healthy Diwali.